Ulcerative colitis, predominantly just in the colon, starts in the rectum and then works its way around. What does that look like when you do colonoscopy? What's the biopsy look like?
If you do an examination with the colonoscopy, what you'll typically see is redness in the colon. It'll almost have a purplish hue to it, and it'll look diffusely inflamed. So the entire colon from start to finish of your exam will look inflamed. It will bleed easily if you move the scope against the lining. The biopsy will typically show you a significantly increased number of inflammatory cells in the tissue than you're used to seeing in a healthy colon.
The treatment that we have now is so different than we had when I started in practice. What is the treatment for ulcerative colitis?
Ulcerative colitis treatment depends a little bit upon the severity of the disease. So if you have mild disease, we still use some of the agents we used back in the 60s and 70s. They're basically medicines that are anti-inflammatories. They're called aminosalicylates, and they work quite well, and they don't really involve a significant level of immune suppression. They don't really...
So what's an example of an aminosalicylate?
So a common one that's used is sulfasalazine. Azicol is another one. These are compounds that have been around for a very long time, and many ulcerative colitis patients still take them and enjoy remission from them.
So they can get into remission with that. Does that mean the disease is permanently out of there if it's mild and they take the medicine and go into remission, or chances are it'll come back, or you don't know?
Well, so if a remission is established, typically the patient will say, my symptoms are much better. You might look at their colon with another colonoscopy, follow up, and see that their colon looks a lot healthier. It may not be completely normal, but it's pretty close. The problem with remission, though, is it is not permanent, and there are plenty of opportunities for patients over the course of the lifetime of their disease to flare again and develop a recurrence of the disease, a recurrence of the inflammation.
Is there anything that you can tell the patient to do with ulcerative colitis that takes medications, that goes into remission, to keep from it coming back?
Absolutely. So the most important factor is for them to stay on their medication at the dose that's recommended.
Okay.
If they can do that, they have the best chance of staying in remission.
So they're going to take the aminosalicylates for a long time on that. Any bad side effects with those?
Usually not. There's very rare instances where they can cause some kidney problems, but generally they're very safe medicines.
So if somebody has severe ulcerative colitis, sometimes do they have to take out part of the colon or the whole colon?
In cases with ulcerative colitis where medicines stop working, or in cases where patients become so sick that they end up in the hospital and their colon stops working, there are instances where patients will have to have a colectomy. When surgery is done for ulcerative colitis, the whole colon is usually removed, because if you don't do that, then the remaining colon that you leave behind will usually become inflamed after surgery. So a total colectomy is typically performed for ulcerative colitis patients.